Hi everyone, welcome back to my channel. I want to start this episode off by saying a massive thank you to everyone out there who has subscribed, watched my videos, commented on the videos, shared the videos, liked the videos, because every time anyone's watching or sharing this content, you're really helping other breast cancer patients and other breast cancer survivors around the world. So a massive thank you to everyone who has jumped on this channel this year and supported me. I really appreciate it. The second thing I want to say is Merry Christmas to everyone. I hope everyone out there is having a really lovely time. But I do appreciate that if you are going through breast cancer treatment, if you've just recently been diagnosed with breast cancer, or if you've just popped out the other side of breast cancer treatment, that Christmas can be quite a difficult time of year because everyone around you is enjoying themselves often and it's not the easiest period to get through. But the best piece of advice I can say is please hang in there, you will get through this, and I'm sure you will have much nicer Christmases to come. People get through their breast cancer treatment more easily if the side effects of their treatment are managed effectively. Now, the first group of people that need to take responsibility for that are the health professionals. So when I say health professionals, I'm talking the medical professionals, but I'm also talking allied health professionals, because we're the ones with the most amount of information, with the most experience and the most knowledge on this topic, particularly the medical professionals when it comes to managing side effects of surgery, chemotherapy and radiation, and hormone blocking medication for that matter. But the allied health professionals are also in charge of helping manage other side effects like lymphedema, sexual health dysfunction, emotional and mental assistance. So there's a lot of stuff that needs to be covered as far as education goes. And first and foremost, I believe it is the health professional that should be at the forefront of providing that education, particularly in the context that if you're a breast cancer patient, you're usually going through it for the first time. So you're a rookie. You don't really know what's supposed to be happening or not supposed to be happening. However, the second most important person in the equation is you. And there's a lot of self-responsibility that you can take to help yourself get through breast cancer. However, you do need a really great health team around you to help you get through. Because one of the biggest problems, particularly with women, is that we're not the best at seeking self-help. We're really good at looking after our partner, husband, children, dogs, cats, aging parents, neighbors, our house, our job. We usually put ourselves last when it comes to self-help. So what often happens is that people, but in particular women, and I'll just put a side note here, of course, to say that the large majority of patients that I'm looking after are women. Yes, men do get breast cancer, but most of the time it is females getting breast cancer. And the biggest problem I see is that women confuse reporting symptoms for whinging. And that's something that's a really important take-home message from this video, particularly if you're trying to get through your breast cancer treatment as smoothly as possible, particularly at Christmas time when things can get a little bit rougher. But if you are going to get through the experience of breast cancer as smoothly as possible, then the best thing you can do is report your symptoms to your healthcare team. If your healthcare team are not aware of your symptoms, then they can't necessarily help you. There's a small caveat to that statement though, and that's your healthcare team should be checking through some classic symptoms that often will arise from breast cancer treatment that you as the patient or the first timer going through breast cancer may not even be aware of. So yes, it's a little bit takes two to tango here, where your health professionals really should be checking off symptoms and educating you about symptoms and what you can do about those symptoms when you go through breast cancer. But certainly you as the patient and you as the person who can be given access to resources that enable you to be educated, you can also start to be reporting your symptoms to your healthcare team. Now here's the second most important point of this video, and that is that your medical team's response to your reporting of symptoms is possibly one of the most important markers of how good a medical team you have. Because unfortunately, too often I have patients in my clinic who tell me that they have reported symptoms to their healthcare team, whether that's medical or allied, and their reporting is not being validated. So if the breast cancer patient starts to have repetitive experiences with any of their health professionals by which they really feel like they're not being listened to, or the patient also feels like they're just whinging and that they're reporting stuff that they shouldn't really bother to report, then they're going to start to stop reporting symptoms, and that's even more dangerous. So really make sure that if you're reporting symptoms to your health professional, whether it be medical or allied health, then make sure that you're getting a response to those reports. So I'll just give you a few quick examples of some symptoms that should be reported to your health professionals. If you've had a portacath put in so that you've got a central line administering your chemotherapy, and that portacath site starts to cause pain, that should definitely be reported to your medical oncologist or your oncology nurses. That's definitely something that needs to be investigated further. Another example is shortness of breath, particularly following surgery or during chemotherapy. Shortness of breath can be caused by a lot of different things, and it definitely also needs further investigation. So this might be your GP, it could be your breast surgeon, or it could be your medical oncologist that is investigating shortness of breath following surgery or during chemotherapy. Sometimes some of our symptoms that we are reporting don't actually mean much at all, and that's also why having a great medical team around you is really important, because you've also got to learn to place some trust in the medical professionals that are providing your assistance. If you are being told that a particular symptom that you're reporting is not necessarily relevant, or it doesn't matter, or it's not going to harm you, then if you're being told that, you need to have a degree of trust in your medical and your allied health professionals that what they're saying is okay. Now, if you've got a gut feeling that something might not be okay, then that's when you need to go and seek a second opinion. As far as I'm concerned, there's absolutely nothing wrong with a second opinion, but the only problem with getting a second opinion when you've got a great medical team is that sometimes then you can be confusing yourself if you're adding more and more opinions. Another example of a symptom that should definitely be given attention would be recent onset of upper limb swelling, particularly on the arm that's had lymph nodes removed, where you could be at risk of lymphedema. So referral onto a lymphedema therapist is really important. Another example would be breast pain in the 6 weeks to 6 months or further following radiation. This could be radiation fibrosis of the breast starting, but ultimately if you go and see a health professional with breast pain after breast cancer treatment is finished, then there may even be a need to send you on for investigations like ultrasounds or mammograms. So there's plenty of examples, as you can see, of different symptoms that definitely warrant attention. So the take-home message, guys, is that if you're getting any symptoms that you're not confident about or you're not sure about, and you're either going through or following breast cancer treatment, then the first place you can start is to report those symptoms to your medical or allied health professionals. The second most important point of this video is that if you feel like your symptoms are not being validated by your health professionals, then that is a time to go and seek a second opinion. It is really, really important to report your symptoms, because this is the first thing you can do to help yourself get better. As I said at the start of this video, the people that get through their breast cancer treatment the most smoothly are the ones that are having their side effects managed the most effectively. Thank you so much for watching this video, guys. I really hope everyone out there is having an absolutely wonderful Christmas. But if you are going through breast cancer treatment and you're in the real thick of it, or if you've just been diagnosed, or if you've just popped out the other side of treatment, then please know that things will get better over time. I hope that everyone's really looking forward to a much nicer 2022. And I'll look forward to seeing you early in the new year after a couple of weeks off for my holidays. If you've got any questions about reporting of symptoms, then please leave a comment in the section below. But otherwise, Merry Christmas, Happy New Year, and I'll see you in 2022.